If you've been recently diagnosed with prostate cancer, no doubt you've seen there are lots of options. There's lots to learn. There's lots of information on the internet. And so when you're at that place of a new diagnosis, it used to be your options for treatment were surgery or radiation. Now that technology has expanded, there are newer treatment options that are available. While that's better for the patient, more options, it can also make things more confusing as to who is a candidate for what type of treatment. So when you're diagnosed here, your treatment can go in many directions. Obviously, we talk about surgery. Surgery is an option and it's been around a long time and it's effective. Very effective for treatment of prostate cancer. So that's surgery. On the other end, radiation. This is leaving the prostate in place, not removing it surgically, but sending radiation type energy, which is like X-ray type energy, directly to the prostate to kill the cancer. Radiation works by denaturing the DNA. So again, very effective treatment option for killing cancer cells when you're dealing with prostate cancer. Some cancers are not terribly responsive to radiation, but most prostate cancers do respond well to radiation treatment. There are different types of radiation. There's IMRT, SBRT. There's brachytherapy, which are seeds that are placed in the prostate. And then there's also proton beam therapy, which is where energized protons are delivered to that prostate gland to kill the cancer. Now with radiation, you may or may not need some type of hormone treatment. The hormone treatment you talk about is called ADT. Androgen deprivation treatment, and it comes in two forms. One, the testicles can be removed. The other option is some sort of medication that's injected that lowers the testosterone, and the testosterone is used by the cancer as fuel. So if you can cut off that testosterone, you can slow the progression of the disease, stop that cancer, and it also can help in these treatments, whether it's radiation or brachytherapy or proton beam or focal therapy. That hormone treatment can help make that cancer more sensitive to treatment. So there's also clinical trials. There's thousands of clinical trials right now that are specifically geared towards focus on prostate cancer. They're typically in tertiary centers, larger hospital units where you can be enrolled into a clinical trial. There's benefits of the clinical trial. You don't need to wait until advanced disease. You can actually do this early on in your treatment. Look at these clinical trials to see if perhaps you are some type of candidate for that clinical trial. So something to consider early on that I think most patients kind of gloss over, don't think about. You can be involved in a clinical trial earlier in your diagnosis of prostate cancer. Now there's focal therapy. Now this is seen as more of an alternative type of treatment, and a lot of insurances will not pay for focal treatment. But the benefit of focal treatment is that you're delivering energy either through the rectum or through the prostate tissue, delivering energy to the cancerous tissue that you know is cancer because you've done x-ray and biopsy to confirm that cancer's location, and you're delivering this ultrasound energy or laser energy or freezing energy to that prostate cancer tissue and preserving that remaining tissue. And what that can do is lower your side effect profile. The treatment effect is not as good as when you compare it to surgery or radiation, but certainly the side effect profile is less. And again, most insurances will not pay for focal treatment, so it can be costly. For people that have metastatic disease, there are systemic therapies. So if your cancer has escaped the prostate and now it's elsewhere, usually surgery is not curative at that point. Systemic therapy is usually what is done for metastatic disease, and that involves androgen deprivation treatment, again, like we talked about here. There's chemotherapy, there's immunotherapy, there's bone therapy, like IV bone therapy. There's anti-androgen medication that lowers the remaining 10% of the testosterone that is produced by the adrenal glands. And then there's also other anti-androgens that actually work inside those prostate cancer cells to decrease progression of prostate cancer. And those are like called Zytiga, Xtandi, there's 5 or 6 other medications like that. Again, systemic therapy, again, usually for metastatic disease. There has been a lot of technology advancement in prostate cancer and in health in general. And one of these major advancements that I believe is a turning point in management of prostate cancer is what's called PSMA, something that was recently approved by the FDA in December of 2020 for use in what's called PSMA PET scanning. And what that does is offer earlier detection of prostate cancer. And again, it's using this PSMA antigen. There's treatments that can be done with PSMA potentially. There's trials that involve PSMA that are very promising. And then you can also know, based on the PSMA expression on your cancer cells, you have an idea of the aggressiveness of cancer. So this can also help with prognosis of prostate cancer. Newer technology advancement, mRNA technology. We've all heard about this in the news, and I believe over the next 1 to 5 years, mRNA technology with regards to treatment of not only prostate cancer, but other types of cancers. I believe this will be something that is more commonly seen and done in the healthcare space. So gene therapy and peptides, these are also things that can be used to help with genetic improvement of your cell and potentially have medicines tailor-made for you and your type of cancers. Now that's on one side, technology advancements. I think for a lot of people we can look that way, but there is something on the more simplistic side of dealing with prostate cancer, functional medicine. And this is the piece I think that often gets left behind. But this involves diet and exercise, and really focusing on what we're putting in our bodies and how we're treating our bodies, because that alone can help fight cancer. We'll talk about diet and activity, the importance of stretching, just basic things like that that can improve your health when you're dealing with a diagnosis of prostate cancer. So this is like a treatment wheel. These are the main treatments for prostate cancer. There are more treatments that are out there, even more alternative treatments that are available for prostate cancer. And at diagnosis, this treatment wheel can be helpful, but also anytime there's prostate cancer progression or return or advancement of prostate cancer, this treatment wheel will also be used to look for other potential treatments for prostate cancer. So when you're here and you're looking at treatment options, it's one of those things that we all want to kind of get to these treatments. It's important to learn about your prostate cancer. It's important to know the basics of just prostate cancer in general. And so that's where I've developed a prostate cancer course that walks you through the steps looking at prostate cancer and then helping you learn more about your specific type of prostate cancer, because that will help in navigating all of these treatment options. Again, the goal of prostate cancer course is to help you better communicate with your physicians so that you ultimately get the treatment for prostate cancer that you want and that is best for you.